And I know that we get the afternoon session, and everybody's had a lot of information today, and then they've eaten really lovely food, and now they're just chilling. So we need to get you guys thinking, okay? First of all, let's get some interaction here. Tell me what you think lymphedema is. Yeah? Swelling? Yeah? Yeah, right.
I like Irene's call. What was it, Irene?
What did she say? What did she say? Pain in the butt. Yeah. Yeah. That's okay. What else? How do we know if we actually have this thing? How do we know? Tell me. Swelling. What else? Pain. Fingers. Tingling. Heaviness. Aching. All those things. It may not be limited to arms when it comes to a breast cancer related lymphedema. It might be the breast. So it may not just be arms. It might be a hand. It might be an upper arm. It might be the breast. It might be the whole arm. So it might be part thereof. But what's the risk? Who can tell me what their risk is? How do they know what risk is? Yeah? 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 Yeah?
What about having IVs and blood pressure?
There's a brand new guideline out about that. Yes. The anesthesiologists have just put an addendum out to their guidelines, dated 2023, to say that there's actually no evidence to say that it will, having a blood pressure or having IV in the lymphedema risk arm causes lymphedema or increases risk of lymphedema. However, I know people are very, very protective of their arms. That's a conversation that you could have with an anaesthetist or an oncologist if you're having chemotherapy. I would still suggest that if you're going to have chemotherapy, not be delivered in that arm, and oncologists would still veer away from that, because having chemotherapy delivered in the arm that's at risk is different to having an IV therapy that's during an anaesthetic. But they're the brand new guidelines. That was an addendum put on 2023. That's very true. Or actually challenging you when you say, please don't use that arm, and they challenge you and you're lying flat on your back starving, you're in a gown, nothing on underneath, you're about to have a major operation, and they're going, no. And that can be really very difficult.
I just said still use that arm, please.
So you feel very challenged by that and intimidated as well, because you're very vulnerable. Yeah, very true. And can you predict it? How do we predict it? That's screening, but how do we predict? So those things I'm going to try and cover, and I've got a very tiny slot. I know, I've got a very tiny slot. And is there a cure? And am I able to reduce my risk? Okay, and how do we treat it? I hope I'm going to answer some of those for you. All right, so I thought we might just take a step back and look at the lymphatic system in itself, because a lot of people, until they've been hit with a cancer diagnosis, actually don't know what lymphedema is. Never heard of it, never heard of a lymph node, don't really know what it does. But it's absolutely amazing. And when I first stepped into my role as a breast care nurse in 1999, there was very little known about it. People were told to put their arms in slings, not use them. So, not a lot of research. But now we know so much more, and we're learning so much more. And I was talking to a colleague. I bought a book on lymphedema by a physiotherapist who's really renowned in the world of lymphedema. And the book's 3 years old, and there's already aspects of it out of date. So that's how quickly it's changing. So just to give you a bit of a recap, blood is exchanged in the microcirculation. So plasma happens, plasma is part of that, is the watery part of your blood. It leaks out. then it bathes the cells, and then it gets drawn back in as lymph. That's when it becomes lymph. As it's drawn back in, it collects proteins and waste. So it's really our sewage drainage system, okay? So it's quite slow moving. Our heart pumps blood, it's faster moving. Lymph is slow. So it uses valves within little lymph vessels, and it uses our muscles. That's why one of the reasons why exercise is really good for us. So lymph, it filters, it absorbs fats and vitamins in the gut. It's very involved in that. We have hundreds of nodes in the gut. We have about 600 in our body. We have anywhere between 10 and 40 lymph nodes in our armpit alone, and we have a lot in our groin, and we have about 200 in our neck. So it's also part of the immune system, so we have T and B lymphocytes, mainly in the lymph nodes, the spleen and the thymus. So with lymph nodes, what are they? They filter fluid in, filters in and out. We have more fluid go in than comes out. So interestingly, on the capillary walls, there's a little protective layer of hair-like structures. So they actually move protein into the circulation, but if there's too much protein in the circulation, those walls thin, become more porous, more fluid leaks out. So there's collagen fibres. We have collagen all through our body. Collagen fibres support those little tiny microstructures, and they break, and they can break down and into fluid, which becomes quite sticky and expansive because collagen's very absorbent. So that's why our swelling with lymphedema can sometimes not feel very soft and spongy, but starts to get a little bit thickened and a bit more difficult to manage and a little bit heavier. So with lymph, it's all about a transport system, and it's all around balance. So when the lymphatics are impacted by changes, the filter rate tends to exceed the transport. So in other words, it's like sitting at a roundabout here at 9 o'clock in the morning and the traffic slows. It's exactly what happens to the armpit, because the lymph nodes in the armpit filter this whole, so lymph nodes in my left arm filter this whole section of my trunk and my arm. So if lymph nodes are impacted in the armpit here, then everything is converging into the armpit where things have happened, whether it be surgery or radiation, so things have had an impact. The traffic or the lymph fluid slows, backs up, pressure changes, and that fluid that's inside the little tiny vessels is pushed out into the cells surrounding, the cells in our tissues. So it's a little bit like the roundabout at 9 o'clock in the morning. And that leads to tissue change, and it leads to inflammation. So they're the lymph nodes. Just a bit of an idea about lymph nodes. What happens is that lymphedema is superficial. It's around the little tiny lymph vessels that sit in the superficial layers of our skin. There's lymph nodes that sit there, and if you peel back the very top layer of skin and you stood over the top and you look down, it would look like fishing nets, one on top of the other. That's what the little tiny lymph vessels look like. And then they feed down vertically into deeper vessels, and eventually there's two big ducts that sit up there either side of our collarbone, sort of below our collarbone. So the lymph vessels feed into lymph nodes filter, and eventually that fluid is put back through those ducts back into the blood circulation. So it's constantly moving, albeit slower than blood. So then we've got to look at, okay, how do we measure what we have as a problem? Okay, we've got fluid in our arm or changes in our arm, but we're not really sure. So there's lots of tools for measuring. Some of them, I bought some props. Trusty old tape measure. That's probably one of the oldest. It's not the gold standard because everybody measures a little bit differently. So we measure at intervals along a limb. We compare it to a side, the other arm or the other leg that's not impacted upon, and then we can compare. That gives us a bit of an idea. The monitor there measures moisture. It measures moisture in the superficial layers of the skin. It's called a moisture meter, or there's a few names for it. Pyrometry, where you're putting your arm out and there's a beam that's measuring along. That's called the gold standard. Or there's water displacement. So basically 2 arms in and one that's obviously heavier, more fluid will come out and then you can measure the difference. That's a bit messy though. So it all comes down to, this is probably the most common that we would use. Moisture meter is very handy to use for areas that are very difficult to use with the tape measure. For example, breasts, genital, abdomen, so it comes in handy to measure neck. People have melanoma treated or other skin cancers treated and they might have lymph nodes removed from their neck. It's very handy. Probably what somebody said was bioimpedance. This is, before we used to have a little machine, people lay down, we had electrodes stuck on them, and it was quite time consuming and costly as well because we'd have to buy the electrodes. Nowadays we have this gorgeous machine here called SOZO, and I suppose most of you had a go on SOZO or have repeated goes on SOZO, understand what it means, that you just, stand on there, bare feet, hands, and within a few seconds a measurement is reached. And basically it's accurate, it's quick. They're looking at research around people having their own SOZO in their home to measure themselves. That's been a little bit of a research project. I think it would be cost prohibitive really, they're very expensive machines, and I think the Cancer Institute is very lucky to have 2. And it measures the fluid that sits outside the cells in our tissues, or what we call extracellular fluid. And it compares fluid in an arm or a leg that's a problem to an arm that's not, or a leg that's not, and pops up a score. And that gives us an idea, which we repeat at intervals, and we're looking for change. We're looking at a trend. So you can see the little graph on the bottom. Green is considered normal, yellow is a little bit in between, but red is outside the limit. And so we have a baseline measurement. Most of you would have had like a measurement taken hopefully before surgery or before chemotherapy. If people are having chemotherapy prior to their surgery, we try to do a bioimpedance measurement because there are some types of chemotherapy when they're delivered, they can cause fluid retention and sometimes lymphedema. So it's good to actually have a measurement before chemotherapy as well. So we like to do what we call a baseline measurement, and we've got something to compare to as you move along with your recovery. It also does other things too. Interestingly, it can measure, because body mass index doesn't really give us an accurate reading of what's going on, because you can have, when you're going through treatment, you can have changes between muscle and fat composition, which actually isn't a really great thing to happen. And we tend to exercise less, which Hugh and Aaron are going to talk to us about, and that creates that change, more fat rather than muscle. But this actually gives you a great reading. It measures water composition, it measures fat, muscle, absolutely fantastic. Scary, but fantastic. It also gives you something to work towards. So when it comes to tools for treating lymphedema, we've got to look at we look at a person holistically, because a lot happens. When someone's diagnosed, we've got a few people in the room here that I know are diagnosed with lymphedema. What does it feel, or what does the worry? I know that's a really big concern for a lot of people, is that fear of lymphedema when they're having treatment, particularly if they need lots of lymph nodes removed, because the issue around lymphedema is when we're talking about what's my risk, there are a number of risk factors. The risk factor number 1 is the more intervention that's done in the armpit, the more the risk, because our risk is anywhere between 5 and 30%. That is our risk in the general population. People have 1 or 2 lymph nodes removed called sentinel lymph node biopsy. Their risk is still around 5%. It's not 0, but it's way better. So the more we have done, the more lymph nodes we have removed, the more the risk. If somebody has all their lymph nodes removed and then has radiation to the armpit or radiation to the lymph nodes here, it potentially doubles their risk of lymphedema. So people might go from 30 to 60% risk, which is pretty high. So then that is one risk. Another risk is infection after surgery. There is a risk of an increasing risk of developing lymphedema when people have a post-op wound infection. That's why we try to be so meticulous about how people are with their pre-surgery prep and care afterwards. The other risk is body mass index. The lymphatics don't like to have a big load, so that's another reason why exercise is so important, is to try and get our body mass index down, because we know that the lymphatics don't really like that. So there are a few of the risks, and ways that we can minimise that risk is become a bit proactive. There's also a discussion around, okay, I've had lymph nodes removed and I'm flying overseas. People get concerned when they go flying overseas. What happens? What do people do? What do they do? Yeah, sometimes, yes. And that's a discussion to have with your therapist, because if you don't have lymphedema, you have a normal SOZO reading, am I going to actually increase my risk by having a sleeve and or a glove that may not be quite correct? Are there ways that I can minimise that risk? And BCNA do some great stuff around flying and lymphedema risk, and actually the fact sheets on lymphedema are really good as well. So I'd have a little read of that and talk with the therapist, or talk with the person who's doing the SOZO. If someone has lymphedema, that's totally different. The best research was done around dragon boating, because when dragon boating was sort of first came to the fore here in Australia, a whole bunch of women came over from Vancouver, because Vancouver in Canada, the dragon boating was quite advanced. And they all came over and they were paddling in Australia, and they actually studied those women when they came out to see what happened to them and their risk of lymphedema when they were flying. And they actually found that there was no increased risk with those women, but they were dragon boaters and they were exercising. Okay, so that's a risk. The ways that we might be able to reduce the risk, exercise, and I'll talk a little bit more about that. But so somebody comes, they say to the nurse, okay, I've got heaviness in my arm, aching in my arm, I've got changes in my SOZO, then that's quite a great tool for screening and monitoring. So screening, we do it beforehand and recognise if there's a problem. Monitoring so that we can be comparing for change. And then what we're looking at is ways that we might be able to check for change. And the whole idea of SOZO being that change can be detected on that reading. 1 minute. Okay, all right. Prior to us having any obvious changes. So there's a whole bunch of stuff, and I did bring some things. So it's around texture. If people have lymphedema in the breast, it's around texture again, and compression. So compression is all about encouraging fluid back into the tissues. It's around skin care, paramount. We want to reduce the risk of infection. Low-level laser has been shown to help. Kinesia tape, which is this sort of tape therapists use, can help. And bandaging and fitting for compression garments. And exercise. Water-based, dragon boating, aquafit. And for any of those who want to come and talk to me later, fly fishing, huge day at Ebor, beginning of December. I highly recommend it, having been it myself. Fly fishing has been shown to increase range of movement after surgery because of the action with fly fishing. So have a think about that. I just wanted to show some of the things that we can do to help. There's lymph pumps, there's nighttime sleeves. The therapists that you see can prescribe garments. There's I've shown some breast garments as well. Lots of different ones. And you can be pretty sassy with it too. You don't have to have those beige ones. I wanted to mention briefly, there's new kids on the block. There are surgical techniques that are happening now and really exciting, not Medicare listed, around anywhere between 5 and 20 grand, but people are doing them. We're doing mapping, and I highly recommend people, when they have lymphedema, they go down to Macquarie University and they have lymph mapping done. That's given, an injection is given into the little spaces here, between the fingers, and special camera is used, TV screen so you can see, and the camera light creates an energy which turns that injection green, so we can actually see lymph channels happening. where is the problem? The big blobby thing, problem. So we're just looking at what we can do, how we can massage, because massage is a very big component, and women are given like a prescription that they can take home, and they know how to massage themselves. Cording, I'll mention very briefly, but cording can occur. It usually resolves itself. Lots of people experience it. It can be quite painful and debilitating, but it is something that can be corrected. They're little tiny lymph channels that tighten up at the time of surgery. And funding, therapists can help with this. There's lots of funding, some private health, GP healthcare plans, DVA is great, NDIS and Enable. And of course, websites for information. And I just wanted to share this with you. This is a really important slide to me because I was there in 1998 when Breast Cancer Network was born. And we did the first field of women, the three in the photograph at the top there, that's me in the middle. That was only a few months after my cancer diagnosis and treatment finished. And my sister is on my left. My sister passed away in 2006 from metastatic breast. And that's my mum on the right, and she passed away a couple of months ago. And we did a field of women at the MCG. My gorgeous daughter and I did a field of women last couple of years ago. We did a field of women, that's the main part of the Coffs hospital. And on that day, we had the Amazon Hearts come through, and they did a thunder ride down under. They were fantastic. They were all breast cancer survivors, a lot of them American, and they picked up some Aussies on the way through, and they did a Harley ride, right along the east coast from Sydney to Byron Bay, and they came to Coffs Harbour, and we had a foyer filled of Harley riders in their big leather jackets, these gorgeous girls talking to the management of the hospital. But just to say that there's so much life after breast cancer, and got to get out and be a part of it. Breast Cancer Network Australia, I couldn't thank enough for all they've done for the women and the community that they've created. So I'd just like to say thank you very much.
Thank you, Lee.